Breaths.
All right, Dr. Emer, you're live.
Hey guys, it's Dr. Emer in West Hollywood, and we're doing one of my favorite treatments today. Look at my hair, I grew it out. You guys know I had a shaved head because I loved Keanu Reeves in The Matrix, so I shaved my head in 1999, and I kept it that way for 13 years. While I was doing PRP injections, it was still getting thicker, it was still looking really good, so I said, you know what, let's grow it out. Let's do like a faux hawk or something. So that's what we got right now. Because I've been doing PRP injections where we draw blood, we inject the serum into the scalp, and some of my patients that either dye their hair or have a little more changes to their hair more frequently, they, the entertainment industry and they have to do things to their hair can sometimes cause the hair to get a little brittle. So we help to thicken it by injecting the PRP and or stem cells. So we're going to do that today in one of my patients who in the previous past had some issues with the hair, regrew really well, and then recently dyed his hair and now has a little bit of brittleness. So now we're going to strengthen the hair. We're going to do some small injections along the area of the front, and it's little pinches. I always tell people in the past when I used to do this, because I've been doing this for a long time now, it's very popular, but before it became really popular, we were doing this, and I was doing this with a friend of mine in New York. We were doing studies on it from 2006 and 7 to 2013, and we were doing all these different things to numb the area, nerve injections and topicals, and it really never really helped. So I always tell people these little pinches will go away quick, a little squeezy ball, a little talk aesthesia, and we can get through it. So we inject this right in large depot injections into the scalp. And this is just going to help stimulate the vitality of the hair. It's going to stop the transition of hairs going from the sleeping phase to the dying phase. We want them to go to the growth phase. So we're putting all this in there. Perfect. Then you guys can see these little injection blebs. We're going to go along the edge a little bit too, through here. Sorry, little pinches along here. You doing okay?
Yeah.
All right, he's doing okay. He works out a lot, so he gets through some hard workouts. And now lean forward just a little bit. I'm just going to do a little bit more in the back right here. Perfect. And then that's really all you're going to need. And now the whole area has been flooded. Perfect. If you guys take a look way back, all these little depot injections, you can see have flooded the area now. So then usually we just do a little massage, almost no bleeding. And you can see these little blebs will then fill the area, and the hair, the follicles of the hair will start to strengthen. It's like fertilizer for the hair. And so obviously there's other things you can do to decrease the rate of hair loss, but one of the things you can do to strengthen it is giving it nutrients like PRP, similar to what we do with protein for our muscles. He'll come back in a month, we'll do it again, because he had more of a shocking issue, and then we'll go to every quarter, every 2, 3 to 4 months afterwards to maintain it like what I'm doing. So that's it for PRP. Bye guys.
Bye.
All right, not too bad, right?
Nah, it gets better.
See?